several of us identified that physicians, particularly those in the community, A, were the source of innovation, not the academics in the ivory tower, with all due respect to these buildings, and B, that they had really very little way to get their ideas to patients. So the underlying assumption is that, at least it's my belief, that entrepreneurship and innovation is community driven. And this room is a good example of people, everyone in this room has terrific ideas, but there are really very few ways to get them to patients or to markets, and that's why we created the Society of Physician Entrepreneurs. So we're a not-for-profit, global biomedical and health innovation and entrepreneurship network that includes chapters around the world. We're arguably the largest physician entrepreneurship network in the world now. And our basic mission is to help you, doctor, get your ideas to patients by providing education, resources, and networks. And I'm going to tell you, the premise has been, and actually one of the doctors in the back says, doctors are lousy business people. And you've all heard that conventional wisdom, and I'm here to tell you that is absolutely untrue, number one. And number two, it really doesn't do a service to fixing the healthcare system. I mean, part of the reason we're in the mess that we're in is, in my opinion, as humble as it may be, that the reason innovation traditionally in the United States has been driven by the biomedical industrial complex. That means payers, hospitals, industry. The two most important elements of the innovation food chain, the patient and the doctor, we're ignoring. And I think we need to change that. And that's one of the missions of SOAP, is to, in a sense, re-empower physicians, not everybody, because, oh, incidentally, of the 1 million doctors that are practicing in the United States, only 1%, in my opinion, have an entrepreneurial mindset. 1. Actually, on the average, if you look at all comers, 3% have an entrepreneurial mindset. So we're even less than the average business, which means if you accept 1 million practicing doctors, we're looking at 10,000 doctors around the United States. Maybe 3 million or 3,000 in 30,000 in Europe, probably 60,000 in Asia. So we're talking about 100,000 doctors around the world. Not a lot of people. So congratulations, you're amongst, in this room, a very select group of individuals. And you should see yourself that way. I mean, instead of dragging your tail and woe is me and God knows what, and ACA and Obamacare, and this is horrible, forget it, just move on. Empower yourself to make a difference. And that's really what we're trying to do with the association. And oh, by the way, one of the reasons that I'm here is to create, or help Dr. Aldine and others create, a SOAP Tampa Bay chapter. So if you are interested in participating in an organization right here to help doctors and health professionals, or anybody, get an idea to a patient, talk to Dr. Aldine. Because that's how we get things done. We work at the virtual level on a website and throughout social media. We have chapters around the place and we have national meetings. So this whole idea is to provide you with the education, resources, and networks you need to get your idea to a patient. Okay? So, I'm here to argue that physician entrepreneurs are not, that physicians are not terrible business people. It's absurd. First of all, what do you mean by business person? What does that mean? You're a lousy investor? Are doctors worse investors than any other investor? I don't think so. Does that mean you don't know how to make money? I don't think so. Does that mean you don't have good ideas and you don't know how to get them to folks? I don't think so. I think actually, and I'm going to give you lots of reasons why I think physicians are terrific entrepreneurs. Now, before I can tell you about that, though, I need to tell you what physician entrepreneurship actually means. Because in this world of innovation and entrepreneurship, there's lots of funny definitions. And if I were to go around the room and ask everybody in this room, tell me what you think innovation is, define it, we'd get a million different answers. Or what's entrepreneurship? We get a million different answers. Well, so here's my definition of physician entrepreneurship. It has 4 basic elements. 1, It's the pursuit of opportunity. 2, the goal of the pursuit of opportunity is to create stakeholder, that is, user, patient, customer, defined value. Parentheses. What you think your idea is worth is irrelevant. Totally worthless. The only thing that matters is what your customer or the stakeholder thinks it's worth. So if you're perseverating on your molecule, or your cell surface receptor, or your health IT idea, or your gadget, and you think it's the greatest thing since sliced bread, it's irrelevant. Nobody really cares. Certainly the investors don't care. You're the only one that cares. So your problem, and I do a lot of work with doctors, entrepreneurs, and service and engineers, and grad students. And they're all very, very, very focused on the solution. I would suggest to you that you be a problem seeker, not a problem solver. It is much more important for you to understand the problem, the customer, the pain, why they would use something that you're going to offer them, than the solution. And my guess is that most of you in the room are about, with the exception of a couple serial entrepreneurs that I've met, are about a solution looking for a problem. Usually not a good way to get there. So start thinking about patient pain, not narcotic pain. Start thinking about market pain, okay? So the pursuit of opportunity with the goal of creating stakeholder / customer, patient, user value by deploying biomedical and health innovation. So that's another thing. What is innovation? How's that different from improvement? Well, in my view, innovation means that you're creating something of value that someone else is willing to pay for. That's the simple definition, or give you something of value. There's a difference between an idea, an invention, and an innovation. An idea is something that popped into your head when you were in the shower this morning. And you know what you did with it? It went down the same place as the water. Gone. If you were to reduce that idea to practice, you'd have an invention. So you leave the shower, you pop up with an idea, you draw a Post-it note, you pick out a felt tip pen, and you draw a helicopter. Now, Leonardo da Vinci did that, but it wasn't an innovation. Why? Because nobody bought it. Why? Because he didn't have the technology to build it. So the next step is you got to get somebody to give you something of value, usually money, not necessarily, for your invention, or idea, or platform, or whatever. So we're talking about commercializing, creating value in exchange for value. That's what innovation is about. And the fun part is you have absolutely no control over how to do this. You have no control over the resources. You have no control over the money. You have no control over how this is going to play out in the market. You have no control over the people that you're going to get. So, and it's always going to be different. This is not a straight line pathway. It just doesn't work that way. This is trial and error. This is experimentation, which I'll get to in a minute. Every doctor in the room is good at that. That's why I think, this is one of the reasons why I think we're good at this. And let's get to value. What does that mean? Value means the difference between the tangible and intangible benefits of something minus the tangible and intangible cost. Okay? So every single thing everyone in this room decides to buy involves that calculus in your head. Every person you decide to date, every person you decide to marry, everything you decide to do pretty much revolves around a cost benefit. What is the tangible and intangible benefit versus the cost? Why would you pay $1.50 more for a quart of milk at 7-Eleven if it weren't for the convenience and they're open at 3 in the morning? It's worth it. That's the cost benefit. So you have to do the same thing in healthcare. And oh, incidentally, in my mind, there's a qualitative and quantitative difference between improvement and innovation. This system is so screwed up, we will not fix it without innovation. Tinkering around the edges, old ways of doing things better, sure, it's useful, but it's not going to get us there, folks. We really have to start thinking differently. And I use the example, I show up in the operating room at 7 in the morning. The start time is scheduled for 7:30. Maybe 20% of the time the knife drops at 7:30. Why? More importantly, how come they didn't fix it? You know, we're talking $200 a minute in an operating room. And then you got the whole schedule backed up. And all the stuff that happens as a result of that. Well, if you had an air traffic controller running the operating room, I'd probably start on time. If you had the technology they use to start airplanes, as we use to start operating rooms, we'd probably start on time. Let alone the interval between the operations, the turnover time. You notice how quickly they clean airplanes and you're taking off while the last guy got off? That's not how we run operating rooms. And that interval between the turnover time is $200 a minute. Multiply that by every operating room in the country, and pretty soon you're talking serious money. So there are ways of fixing these problems, but in my view, doing it incrementally is not going to get us there. In fact, I think incrementally is what got us there. And there's that old saying, you know, why would you expect using the same thinking to solve a problem you created using the same thinking? Like, why would you expect that? It doesn't work that way. So I'm encouraging you to use a trite phrase, think out of the box, innovate, whatever you want to call it, but we need more than just increments. We need significant innovation. Now that innovation can be biomedical and it can be health. It can be products, services, platforms, systems. It can be really any way that you're adding value that someone is willing to give you something in exchange. Okay? So, do I think doctors make good entrepreneurs? You bet. I go around the world talking to them. I know them. I see them. I have stories of people who have created stuff and created significant value. You have people sitting in this room who've done it. And if you look at just entrepreneurs in general, and you look at the entrepreneurship literature, and oh, incidentally, I think one of our agendas should be to legitimatize medical entrepreneurship as a legitimate academic domain. Now I work in a business school. I also work in a medical campus. And I'll tell you, that's an uphill battle. And if you talk to my colleagues in the business school who tried to develop entrepreneurship as a legitimate academic domain 15, 20 years ago, they had the same battle. There were no journals. There were no recognition for promotion and tenure. There was no annual meeting. There was no sitting professor of entrepreneurship in any of the major business schools. We have to change that. And myself and others are trying to do that, and in increments I think we're being successful. So the key traits, and this is Harvard Business stuff, if you look at the key traits of serial entrepreneurs, they did this survey, they asked a bunch of folks, and basically it comes down to, what are the traits of entrepreneurs? Now, there's been a lot of literature on this, and the bottom line is, there is no difference between regular business people and entrepreneurs. There really isn't. However, there is a difference between entrepreneurs and innovators. And innovators have a certain mindset. They're hardwired a certain way. And I'm not trying to make you an entrepreneur. Why? Because I can't. It's stupid. I've given up trying to change patient behavior. I have tried to change patient behavior. That's worthless. I don't do that anymore. I don't try to change people's behavior. It's a total waste of time. Any more than I can train someone how to be a surgeon, which I spent my life doing, but I don't train them how to be a surgeon. I teach them how to do surgery. They come to me, pre-selected, through medical school, as a surgeon. It's an interesting phenomenon, and actually all the doctors in the room know that in most instances, that pre-selection process seems to work. Very few doctors actually in the middle get an epiphany and they say, you know what? I don't want to be an internist, I want to be a brain surgeon. It doesn't work that way. You come pre-selected. Then we give them the platform to be successful. Same thing with an entrepreneur. I can't teach you how to be an entrepreneur. I can teach you the skills necessary to start a business. I can teach you the elements of getting an idea to market, but I cannot change your DNA. I cannot unhardwire you. And I'll tell you what that looks like. So you look at the things like persuasion, leadership, personal accountability, a lot of traits that resonate with doctors. So what's an innovator look like? Well, most of you understand Clayton Christensen. You probably read most of his books, Disruptive Innovation, blah, blah, blah. He's been all over the press. Anybody who understands anything about, who's interested in this subject has probably understood or heard the term disruptive innovation. That's his term. He also wrote a book called The Innovators Dna, which essentially says that if you look at, and they did, a bunch of people who they classify as, quote, innovators. Now, we can argue about, well, who's an innovator and who isn't, but let's just assume he's right. He's a smart guy. He's at Harvard Business School. He's made $1 gazillion. Let's just trust him. Let's just take his definition and say, what do these folks have that other folks don't? And basically, he identified 5 traits. Questioning, associating. In other words, they can kind of put things together. It's like pattern recognition. Connecting, which is what we're doing in this room and why you're here. Experimenting, and then observing the results of the experimentation and changing their behavior to compensate. Now, are doctors very good at these things? You bet. It's what we do every day. Taking care of patients, doing experiments, running something. It's really about connecting dots. And that's what Steve Jobs said. Innovation is about connecting dots. There are very few things in healthcare, problems in healthcare, that have not already been solved by some other industry. All you have to do is ask them. And I congratulate the folks who put this group together, because that's why you're doing it. If the Society of Physician Entrepreneurs were just about doctors, it would be the blind leading the blind. What do we know about this? We screwed up the system. Now you're expecting us to fix it? I don't think so. I need folks like you in telecom, in aerospace, in IT, in financial services. You've already solved a lot of the problems we're facing in healthcare. That's what connecting the dots are about. And if you look at most entrepreneurs, whether they be physicians or not, they have enormous networks. Why? Because that's how you solve problems. That's where you get the resources. That's who turns you on to people who can help you solve your problem. And if you look at universities like this and like mine, one of the ways of measuring innovation is the pressure of networks. What that means is internal and external networks. How connected is the University of South Florida to the community? Or the University of Colorado? Now, I don't know what the guy across the hall from me does. I don't even know who it is. But there has to be an internal and external network that allows you to compare notes and let this information flow, and that's what this meeting is about. So I would say that particularly radiologists, dermatologists, visual specialties like ophthalmology, ENT, we're very good at pattern recognition. You go to any doctor who's experienced, and basically in 30 seconds they can tell you what's wrong just by looking at you. So we're very good at pattern recognition and all these other things. So why am I here? Why did you invite me? Thank you very much. Now, to talk about this. I mean, just how a lot of other folks you could invite it. But for some reason, this topic is resonating, not just in Tampa, Florida, but around the world. This same conversation, I can tell you, is going on in Lisbon, Portugal, in Greece, in the south of France, in Malaysia, in Africa, in India. Everyone is concerned about how do we provide healthcare with limited resources. And as I said before in this other talk, wherever this healthcare system lines up, someone will be dissatisfied with it. It's a basic truism of health systems around the world. No matter how good they are, the more they complain. Too much, I don't get enough access, I don't like my doctor. Governments say, well, we can't sustain it. Inequity, gotta wait, there's a waiting list. Everybody's gonna complain about something. So we're never gonna get there 100%. And so don't even try. But let's try to move the 2.7 trillion needle to something that's reasonable. So why am I here? My view is that when people say, why are doctors such lousy business people? First of all, I don't agree with it, as I told you. And secondly, because they never had to be. In other words, if you were a doctor way back in the day, like last year, you really didn't have to be very savvy at any of this. You could basically be the last person in your class to graduate. They call you doctor, you hang up a shingle, you take a residency, you go to work, and for all intents and purposes, you make more than 99% of the people in the world. All you have to do is show up. And the beauty of it is, you get paid for effort. We get paid for effort. I get paid for effort. You don't even have to show results. All you have to do is show up and do stuff, and they pay you. How good is that? Well, unfortunately, that's why we're in a situation that we are, in part. So I think there's attention to innovation and entrepreneurship in healthcare because really, we didn't have to pay attention to it before, and now people are being slapped in the face with it. So I think there's more of an appeal. I think that the demographics of physicians, and you heard this before, that something like 50% of physicians or 55% of physicians in the United States are over 55. So there's a big retirement bubble happening. The policymakers are looking at the pipeline and saying, who the heck's going to take care of 30 million people in 2014 above and beyond what we're already doing? There's a supply and demand inequity. So we have to come up with innovative ways to cover the gap. I can tell you about a lot of different ways I think that's going to happen, but that's what we're doing. So we have to innovate to leverage our abilities because there just aren't enough doctors to take care of all the people. So we have to move from, and this campus, like my campus, is an example of top-down, community-based cluster formation. Let's build a lot of buildings, fill them up with tech transfer, have an incubator, do bioscience commercialization, and we'll fill it up with people and hope that we'll churn out bioscience companies on the bottom end. Unfortunately, in my opinion, these large infrastructure projects, while they're useful, I think are being supplanted by community-based innovation. In other words, the availability of the internet, social media, companies like 23andMe, companies like the Society of Physician Entrepreneurs, crowdfunding, crowdsourcing. I got a note from a guy who said, what do you think of this idea? We're going to create a website, it's a real idea, we're going to create a website that's going to allow patients to diagnose other patients. Honest to God. So here's the idea. The wisdom of the masses. Oh, my Uncle Jim had that twitch, and he had Parkinson's disease. I think that's what you have. Honest to God. And that's that community-based, now, that sounds funny, but it's an example of community-based bottom-up innovation, and I actually think that's a good thing. Because, again, despite of the 1 million doctors that practice in the United States, 5% of them, 4% of them look like me. An academic working in a place like this. 96% are like you. People in the trenches slugging it out. And my impression is that the innovation comes more from you than it does from me. You're the guys that are going to change the system. But you don't have anywhere to go to get the ideal patients. So that's why we created this organization. Of course, there's all this pressure for change, different generational attitudes. My view is that physician entrepreneurs come in 5 flavors. They're private practitioners, small to medium enterprise business owners. They're corporate entrepreneurs, people who have an idea, they try to get it to market and scale it and exit. Social entrepreneurs, people that want to cure malaria in sub-Saharan Africa and they don't really care if they make a nickel. Employed physicians, intrapreneurs, single largest growing group. And service and freeloaders. Oh, I'm sorry, freelancers. Doctors who try to help other doctors. You know, some become CPAs, some become wealth managers, some become certified financial planners, some become webmasters. I mean, you'd be amazed at what doctors are becoming. And you've seen them, you have them in your community. So those are the groups, and they all have different value propositions, they all have different needs, but the point is, when you divide those groups into generations, there's what I call the young and the restless, the desperados, and the old and the grumpy. And what you're seeing is people like me, the old and the grumpy, over 55, we're done. We checked out a long time ago. And we're the laggards. Don't even go after us. And the guy said, I'm having a hard time getting a 65-year-old to use an electronic medical record. Well, of course you are. I mean, where's his head? And when you look at the young people, medical students, residents, fellows, people in training less than 5 years, my view is that if we let them, if medical schools let them go to medical school, about 5 to 7% of medical students have no intention of practicing medicine. None. The only reason they're going to medical school is to get the MD after the name. Maybe they'll do a residency to get clinical credibility, and then they'll go start a company. Of course, medical students are too smart. They're going to look me in the eye when I'm interviewing them, and they're going to say, well, why do you want to go to Colorado and be a doctor? You really think they're going to say, I don't? I want to start a company. The only reason I'm coming here is to get the degree. I don't think so. So we have to change our mindset. I personally would rather have the best athlete on the team than look for a skilled position. And if I can pick a guy or a woman in medical school who can create a company that employs 1,000 people and helps millions, I think that is more valuable than a doctor who sees 20 patients every day for 40 years. So I think we have to change our attitude. I need to wrap this up. Because I could go on, obviously, with this forever. But, so let me get to the bottom line. So what are 10 reasons why I think doctors can be excellent physician entrepreneurs? They know how to build clinical judgment. Every doctor in this room knows clinical judgment means experience. Experience means learning from your mistakes. Same deal in business. It's experimentation. You try something. Doesn't work, you fix it. Eventually, you develop business judgment. We call it clinical judgment. But it's the same deal. It's about research and experimentation, which almost every doctor in this room has done. We're used to dealing with uncertainty. I mean, 25% of Western medicine is based on fact. 75% is, well, let's try it. I heard it worked. And then if it doesn't work, it's called a clinical trial. You give you a drug. If it works, great. If it doesn't, I'll give you something else. It's trial. It's experimentation. It's what we do. We have a bias to action. We don't sit around and cogitate all day long unless you're a nephrologist. If there are any nephrologists in the room, it's an inside joke. But you know, there's a bias to action. We're excellent at pattern recognition. It's what we're trained to do, whether you're reading a CT scan, it's whether you're looking at a skin lesion, it's whether you're looking up somebody's nose, it's whether you're, I mean, it's what we do. We connect dots. That's what experience is about. We know how to do all the things that I said innovators know how to do. We know how to assess risk. Entrepreneurs are not risk takers. And I hear this over and over again. Well, doctors are risk averse. They don't want to give me money, they're cheap, they're risk averse, all that. Successful entrepreneurs manage risk. They accept it. And they're really good at it. It doesn't mean you take crazy, jump off the cliff things. It means you assess the risk and you make a decision in terms of the risk return. And the doctor does the same thing every single day. It's, if I do this to you, does the benefit of what I'm trying to do outweigh the risk? Every single patient. Sometimes we get it wrong, but we're playing the odds. Sure, there's an outlier. You thought you were doing something right. You put a stent in somebody's heart and they died. Most of the time it works out okay, but sometimes it doesn't. And then you go back and try to figure out what I do wrong, if anything. Sometimes most of the time you didn't do anything wrong. It's the law of probability. You do something enough, somebody's going to get sick or die. Otherwise, you're not doing it enough. Same deal in business. I really think that of the roles that doctors play, and they play core entrepreneurial roles, they're inventors, they're market perceivers, managers, and investors. They're the only people in the system that understand the market. And they have experience, and this last one, which is a little disconcerting maybe to you, but doctors are good at pulling the plug. Now, in worst case scenario, every doctor in this room has had the unpleasant experience of facing a family in the ICU and saying, you know what, your mom just isn't going to make it, we think it's best we stop life support. That's a hard decision. And I tell my friends in business, you know, if you're sweating over pulling the plug on your business, think about what doctors have to do when they have to pull the plug on a person. It's trivial. So big deal. You pull the plug on the business, and actually, the entrepreneurial mantra is you kill it fast, you kill it often, and you kill it cheaply. One of the biggest problems I see with technology commercialization is the cost of failure, not the cost of success. Because if we manage the system properly, you should know your idea does not have legs before you start spending a whole lot of money on it. And you kill it early and kill it often. So, summary. Despite what you have been told, doctors are not lousy business people. I'm sorry. I hope I've convinced you of that. In fact, by neglecting them, I think you are disintermediating a critical portion of the innovation food chain in healthcare. Innovation is becoming more community-based, will continue to be so, and as long as cheap telecommunications and social media has a part, it will continue to play a major role. And finally, be nice to your doctor. Don't complain about your copay or the parking. These people are just burned out, and all they're really trying to do is help you. Thank you very much.